Victim can legally use marijuana if he can get his hands on it.
This is KMOL News Nightcast.
Good evening, I'm Deborah Daniels. It is a life and death battle, and there's something that will make the fight easier for a local AIDS victim. The FDA gave approval for the use of marijuana as a treatment, but that was last month, and the man known as Steve says he still hasn't received the drug. He says it's because of confusion over paperwork. But today, the local drug enforcement agency told us the papers have been filed, and Steve could have the marijuana by the end of the week.
I thought that I could explain to somebody that I'm terminally ill, and I had the worst thing anybody could think about having. That people would help me out, and I'd get it quick. But that's not the way it works.
Steve uses the marijuana to alleviate pain and nausea. Joan Lucas will have more on Steve's unique struggle in a focus report later in the newscast. It is what many AIDS patients see as a ticket to relief. So far, only one AIDS patient in the country, a San Antonio man, has been approved by the FDA to use the drug as treatment. But as Joan Lucas tells us in tonight's focus report, the ticket isn't taking him very far.
Worried about how long you're going to live or not. You just hope that a medicine comes by that'll help you cope until a cure comes around.
The medicine that Steve believes can help him cope is marijuana. This 34-year-old has been fighting AIDS for 2.5 years. In one 7-week period, he dropped from 156 to 80 pounds. He says pot increases his appetite and eliminates nausea and vomiting, something that would help him fight back against the disease. Last month, the FDA approved Steve's use of the drug in treatment, but so far, he hasn't received it.
It was supposed to be here in a few days, and then like they're saying, well, we need this form. We don't know how we're going to order it. Everybody had a finger pointing at other people, and it seems to me like we covered all the areas, and it's the DEA that's been the problem.
DEA's function in this is very minor.
Bob Randall is the president of Cannabis Therapeutics in Washington, D.C. His group helps patients like Steve. Randall's battle is personal because in 1978, he became the first glaucoma patient to receive federally grown marijuana cigarettes. He says the DEA is only one arm of the government playing a part in Steve's case, but it's playing politics.
If everything had gone smoothly, Steve would have gotten his medication the same week the DEA was announcing publicly they didn't think marijuana had medical value.
DEA officials refused to talk to us on camera, but agents say many of the parties involved in this case, including Steve's doctor, were unfamiliar with all the needed paperwork. Agents say they acted as quickly as possible, and the final ordering forms were faxed this afternoon to the National Institute of Drug Abuse. And it's that agency that should be mailing the marijuana to the VA hospital by the end of this week. But Randall says it can't come soon enough.
When he's smoking marijuana, he's living with AIDS. When he's forced off of marijuana and he's forced on tranquilizers, narcotics, and other very powerful drugs, he feels he's dying with AIDS. And if you're the patient, that's a hell of a world of difference.
It's a lot of hard work when you're dealing with the aspects of death and dying. And quite frankly, I still want to live, and I hope that I overcome my illness. You know, but all you can do is just one day at a time.
Joan Lucas, KMOL News, Focus.
Whether or not marijuana is a viable treatment for AIDS patients is still being debated. Steve was approved as a candidate for testing because he was unresponsive to other drugs, but issuing marijuana to more AIDS patients will be done on a case-by-case basis.
About half of Texas is drooling right now.
And the other half is wanting to arrest us. So
yeah.
They are smoking marijuana. It's a crime that could land anyone in prison, but not these men. This week, Steve became the first AIDS patient in the nation to have a prescription filled for marijuana. Steve is in the advanced stages of a 3-year battle with AIDS. He says he lost more than 75 pounds in 1987.
I've used it in my earlier years.
Steve knew marijuana would give him the munchies, increase his appetite, and boost his weight. But last March, police arrested him with 14 ounces of the controlled substance. His case is pending. After a frustrating search to get marijuana legally, he turned to Robert Randall.
Without marijuana, I would go blind.
Randall suffers from glaucoma. Researchers have proven marijuana can relieve pressure on the eye. In the mid-'70s, Randall was arrested for marijuana possession, but he became the first person in this country to have marijuana prescribed for medical use.
And the judge ruled that any sane person confronted with a choice between going blind and maintaining their sight by breaking the law to use marijuana would break the law.
The Food and Drug Administration approved of Steve getting marijuana in December, but somewhere in the federal bureaucracy, the approval stalled until last week. Steve legally smoked marijuana Thursday for the first time, and already he says it has curtailed nausea and vomiting.
Well, today I ate more than I ate the whole time that I've been in the hospital. It definitely increased my appetite.
Doctors here at Veterans Hospital will be keeping a close watch on Steve's condition to see if there's any medical benefits using marijuana.
It's possible that the first case may smooth the pathway for future patients. I'm not certain of that. But
Steve and Randall know marijuana has side effects, but say the benefits of the substance outweigh those concerns.
And it's 13 years later, and I still have my sight.
And for those who would condemn this,
if a man smokes a cigarette and looks at me and tells me because I got AIDS I shouldn't have medicine I need, why should he get care when he gets a heart disease? The person who drinks, who gets a bad liver that may one day need help, or someone they love or know, we all have the same rights. We live, things come up, and we all deserve treatment.
Michael Hill, Channel 8 News, San Antonio.
Prosecution, it's a simple case of drug possession. But for Barbara and Kenny Jenks, marijuana isn't for stimulation, it's for self-preservation.
I fully believe without marijuana, my quality of life is going to deteriorate and I will die. And I believe my wife will die too.
28-year-old Kenny Jenks and his 24-year-old wife, Barbra, are dying of AIDS. He is a hemophiliac who received a blood transfusion tainted with the AIDS virus and ultimately passed the infection onto his wife. But the drugs that treat AIDS cause side effects nearly as painful as AIDS itself.
Because it controls my nausea, it controls my muscle spasms that I do have, and my nerves, I eat. If it wasn't for smoking marijuana, then I would just waste away.
Whatever relief marijuana brings, it's still against the law. And police in Panama City, Florida, acting on a tip, burst into the Jenks trailer home in March and arrested the couple on charges of possessing 2 marijuana plants.
Gosh, our whole life, they destroyed our whole life.
For years, there has been debate about the therapeutic use of pot. Robert Randall heads the Alliance for Cannabis Therapeutics. He smokes 10 joints daily to keep the effects of the blinding disease glaucoma at bay. But he fought with the government for 3 years to win the right.
Yeah, the seriously ill have become unintended casualties in the war on drugs. I mean, we're caught in the crossfire.
34 states have passed resolutions to make marijuana available to the sick, but the Drug Enforcement Administration is opposed to reclassifying the drug so doctors can prescribe it. Physicians are caught in a bind, even though many studies show the drug is useful.
What it's going to do is improve the patient and help them feel better. And it's going to relieve their nausea and vomiting. It can stimulate their appetite.
Other experts say medical marijuana's risks outweigh its benefits, and that making it more available could put pot into the hands of drug abusers. Synthetic marijuana in pill form has been an unacceptable substitute for many. If the Jenks are found innocent, it could set a precedent.
Where does the court draw the line? Suppose I get a case in next week, the fellow has a severe back pain.
But the couple's lawyer says it's a matter of medical necessity for them. Whatever the outcome of the Jenks case, the controversy over the medical use of marijuana will continue. The question is less over the drug's merit than how to get it to those who need it legally. Jeff Levine, CNN, Panama City, Florida.
I've got to smoke marijuana. I've got to. If I don't, then I'm gonna die. I'm gonna die anyways, but I would like to have my life a little bit longer.
24-year-old Barbara Jenks has AIDS. She, along with her husband, Kenneth Jenks, who also has a terminal disease, face various marijuana charges. Kenneth, who suffers from hemophilia, says he contracted AIDS from tainted blood during a 1980 transfusion. The couple testified that smoking pot has helped prolong their lives. Under oath, each claim marijuana is the only drug they found that reduced nausea associated with AIDS. Another problem experienced by sufferers of the fatal disease is rapid weight loss. Kenneth Jenks said that marijuana helped in this regard.
So I tried it first, and gosh, about an hour after I tried it, I was eating everything in the house. And then my wife, she got over her reluctance, and the next night she tried it, and God, our whole life changed. It would change for the better.
The non-jury trial is before Judge Clinton Foster. Foster told defense attorney John Daniel that permitting the couple use of pot might open the floodgates. The judge said he's concerned that others with all kinds of ailments would want access to marijuana. Foster said he would hand down a decision in the Jenks case within the next few days. Mike Gerspan, 13 Eyewitness News.
I'm Steve Wilson. A miracle cure called marijuana?
Now that I know it works, you know, and it's helped to save my life.
Not a cure, really, just incredible relief from the symptoms of AIDS. Relief worth going to jail for, say these two.
The relief, it only takes a couple hits of marijuana, and you just sit down and, I mean, within 15 minutes or so, you know, the effect is it's just unbelievable.
They have found a drug which can help prolong their lives. No sane individual would not break the law in order to prolong their life.
Lots of people have been arrested and gone to jail for using and even growing marijuana here in Florida. Well, next up in the Florida Spotlight, I would like you to meet a couple with a story the likes of which you've probably never heard. Here in the Florida Panhandle, they have been using marijuana to relieve their pain and suffering from a fatal disease which both of them share. But the law is the law, and for this, they are criminals?
Justice and right have something to do with each other, I believe, and I don't think these folks have been treated right.
John Daniel is one of Panama City's most respected defense attorneys. But when his clients, Kenny and Barbra Jenks, shook his hand and left the Bay County courtroom several weeks ago, they left convicted of a serious felony. Long before they landed in court, Kenny and Barbra were victims of a string of tragic circumstances. He is a 28-year-old hemophiliac, a bleeder, someone who has needed to take extra blood products all his life. Sometime, somewhere, some of the blood he got was tainted with the AIDS virus. And before he even found out, almost 2 years later, he had passed the deadly disease to his young wife. For reasons doctors still don't know, she got sicker quicker and ended up in a hospital near death.
She was extremely short of breath, nauseated to start with, losing weight, having night sweats, chills, could not sleep, could not eat. She was deteriorating very fast.
But the doctor says, like in many such cases, side effects of the strong drugs she needed made her almost as sick as the disease.
The treatment by itself was extremely toxic to her, causing nausea, vomiting, allergy, rash, more weight loss. So you can imagine that we complicated an illness by treatment.
All of the doctor's other patients in that same shape have died within 2 years. But 2 years later, her doctor says...
Barbra looks great. She's turned around favorably. I honestly felt that Barbra wouldn't be around for 6 months to a year. And it's a miracle to see her doing so well at this point.
It was in the midst of misery after she was finally out of the hospital that Barbra Jenks says she and her husband found their own miracle medicine, something far more effective than anything Dr. Ortega or his colleagues at the hospital could provide. But the only treatment that seems to relieve the terrible side effects Barbra and Kenny suffer from their AIDS medication is more than unconventional. It's against the law.
I'm not saying try it, but I mean, I smoked a marijuana cigarette, and it's like it just took it all away. It took the nausea away. I was able to eat. The disease itself gives you nausea, but the medicine that you take, like the AZT and the butamidine that they give you, is more nauseating than the disease.
But if you don't take the medications, then you know, you've got nothing to fight the disease. I mean, you're just going to waste away.
I used to carry a bag around with me because,
she would throw up. She'd literally have to carry the bucket in there and set it beside the couch because she couldn't make it.
Barbara is better. Compared to the first day I saw Barbara, this is a new woman now.
But after they started growing their own marijuana medicine inside their Panama City Beach mobile home, somehow the police found out. Armed with a warrant, Detective Tom Harris and a narcotics task force stormed in late one afternoon.
Well, we found the marijuana plants growing in the back bedroom.
How many?
I believe there were 2.
2 plants?
That's correct.
Well, it wasn't one of your bigger busts, was it?
No. Yeah, we go after pot, cocaine, anything aggressively. Yes, if it's against the law, we do.
Any amount?
Any amount.
State Attorney Jim Appleman's office took the same hard line to court and won the felony convictions after the Jenks told the judge the same story they've just told you.
So you're felons?
Well, but the judge withheld adjudication of guilt.
I'm not a criminal. I'm doing something that is saving my life. I mean, there's a big difference there. I'm not a criminal.
But you broke the law.
We did break the law, but, I mean, we didn't have any alternative. I mean, at that point, what do? Give up?
The decision was that I'm dying. Marijuana can help prolong my life. It's illegal. Should I break the law to get the marijuana I medically need? Absolutely. Any sane person in your audience would reach that decision.
Robert Randall has fought this fight and now gets legal prescriptions for marijuana provided to his hospital pharmacy by the U.S. government. He gets them in regular little prescription bottles. They look like non-filtered Camels, but these Camels have not just more kick. Robert Randall and his doctors have convinced the courts in Washington that his use of marijuana has had a profound effect on his glaucoma, an eye disorder.
If it weren't for marijuana, I would be introducing you to my seeing eye dog Rex. So I still have my eyesight because of marijuana. Kenny and Barbara Jenks' doctor knows they should have marijuana. He cannot simply sit down and write a prescription. Instead, he has to go through a complex bureaucratic procedure dealing with 3 different agencies in Washington, D.C. It's now nearly 4 months since he's made that application, and we have 2 young people who are literally dying in the public eye while federal agencies do nothing.
They had an avenue to go through that they could have utilized, yes. It may take them a long time.
And they may be dead before it happens.
And they may be dead before it happens.
Too bad.
But there is a procedure that you must go through.
I'm talking about people who are dying of a disease that is not curable, and we want to relieve their pain and suffering. We can't use discretion to be compassionate just to help someone who's dying?
Sure, in the sentence. That's where the compassion came.
And send them to their graves convicted criminals?
Essentially, you're sitting there with a circumstance of you have a violation of the law, and you have to look at that circumstance from the standpoint of, what about others?
Judge Clinton Foster was sympathetic in his sentence. He gave the Jenks 1 year unsupervised probation, withheld court costs and fines, withheld adjudication of guilt, and ordered 500 hours of community service to be discharged only by their providing care, comfort, and concern for each other. But they remain convicted of a felony, and neither has ever been arrested for anything else in their lives. If the convictions are not overturned on appeal, only the governor and the clemency board can clear their names, and a pardon is very important to them.
These good people, they don't want to die as criminals. That's why it's important.
I'm not giving up. Because I don't want to see somebody else in the same spot as what we were put in. And if it's the last thing I got to do, then fine. I'm perfectly happy at doing it.
The State Parole Board and Governor Bob Martinez could conceivably commute Kenny and Barbara's sentence before he leaves office. Otherwise, Governor Childs, what will you do?
This is Chicago's very own Midday News.
A newly formed organization wants to help AIDS patients get legal access to marijuana. The group, known as the Marijuana AIDS Research Service, or MARS, says a side effect of the drug can alleviate one of the AIDS symptoms.
One particular problem that AIDS patients confront is a rapid loss of weight, which can be life-threatening in and of itself. And to the unintentionally anorexic, the munchies can be a lifesaver.
The Federal Drug Enforcement Administration prohibited the use of marijuana for therapeutic use in 1970. And speaking of therapy, Tom Skilling says temperatures tomorrow may be approaching 60 degrees. He'll have the latest right after this.
This is Channel 5, your 24-hour news source.
And a good diet can mean the difference between life and death for AIDS patients. And in some cases, it can be argued that that diet needs to include marijuana. Channel 5 health reporter Dr. Barry Kaufman is here with details. Barry?
Joan, ever since we did the first story about it back in the late 70s, we've known that marijuana helps some cancer patients overcome the nausea of chemotherapy. What's not generally known is that some AIDS patients are taking marijuana too. AIDS itself can cause loss of appetite, and AIDS medications can cause nausea. That leads to a loss of weight, a wasting away, which robs the body of vital nutrients. It needs to keep fighting the disease.
I went from 155 pounds to down to about 112, 114.
Barbara Jenks and her husband Kenneth both have AIDS. As a hemophiliac, Kenneth Jenks had apparently contracted AIDS from a blood transfusion, then unknowingly passed it on to his wife. A major complication for both of them was weight loss, until other AIDS patients began supplying them with marijuana.
My wife was reluctant to try it, but I tried it that evening. And after 20 minutes, you know, I felt better. I didn't feel like I was about to throw up. And within an hour, I mean, my appetite was unbelievable. You know, I couldn't get enough to eat.
The Jenks now receive marijuana cigarettes legally from the federal government. But they learned about the legal program only after suffering a traumatic arrest for growing 2 pot plants in their Florida trailer home.
There were 10 or 12 policemen with shotguns and, you know, pistols waving in the air. And they held guns to our heads and handcuffed us and hauled us away to jail.
Today, the Jenks joined a news conference designed to let other AIDS patients know that their physicians can get marijuana legally. The process is involved and takes from 3 months to nearly a year. But Marijuana AIDS Research Service Director Robert Randall hopes the time can be shortened.
It's not the perfect solution, but we hope that we can help AIDS patients gain legal access to marijuana before they're arrested for using it off the streets.
The marijuana comes from this government-run farm in Mississippi. The cigarettes are rolled in North Carolina and then distributed to research facilities and patients. So far, only 3 AIDS patients are signed up legally, but Randall estimates illegal use is much higher.
Between 40 and 50% of patients who have advanced HIV infection appear to be using marijuana.
Today, a number of Chicago AIDS organizations were present. Lisa Laughlin and Linda Taylor counsel AIDS patients and now want to find out more about the possible benefits of marijuana.
It's another piece of hope that we can offer these people. I mean, anything that's going to help us tell these people that they're positive and give them some kind of hope is helping us too.
Now, there is no cost for people who are in the program. There is a pill containing the active ingredient marijuana, THC, which is available by prescription. And while cancer specialists use it occasionally and say it works well to prevent nausea, Marijuana AIDS Research Director Randall says the pills often lose their effectiveness after several months, and that's why they're advocating the smoking. There's an interesting postscript to this in terms of the Jenks. They are still in court fighting their battle, but the judge originally who found them guilty sentenced them to unsupervised probation and 500 hours of community service, which was to be carried out by them loving each other.
Isn't that interesting?
So there was a compassionate judge, certainly.
Apparently so. Very nice, Barry. Thanks.
Distributing marijuana cigarettes strictly for medicinal purposes. Doctors believe it relieves nausea and vomiting in some cancer and AIDS patients, but now the government says that the practice will be discontinued because it undercuts the Bush administration's war on illegal drug use. And joining us today to discuss this development are Lee Dogloff. He is the executive director of the American Council for Drug Education. He is the former drug policy advisor for President Carter. Robert Randall is with us. He's the president of the Alliance for Cannabis Therapeutics. He uses marijuana to alleviate symptoms of glaucoma. And on the phone with us today is Ken Jenks. He and his wife have AIDS, and they have been receiving monthly allotments of marijuana from the government. Welcome to all of you. And Ken Jenks, I'd like to start with you and tell us what symptoms marijuana relieves for you and how long you've been using it.
My wife and I have been using marijuana for 2 years. We've been, what it does for us, it alleviates nausea and vomiting, and it stimulates appetite. Now, we tried 6 different legal drugs before we tried marijuana, and none of them worked. And so after finding out marijuana worked, we began using it, and our nausea and vomiting went away, and we also had an appetite. And for an AIDS patient, that can save your life.
Now, Ken, I understand that you got AIDS through a blood transfusion. Your wife contracted it from you. Have you used the drug Marinol, which has the substitute, the synthetic cannabis in it, and has that been effective at all?
Yes, ma'am. My wife just recently was given Marinol in the hospital, and for her, it made her sicker than without the drug. She threw up. She had anxiety attack. She just, it was like she was going 100 miles an hour in a car, is the way she described it, and the speed limit was 50. She just couldn't tolerate it. It was an unsafe drug for her.
Ken, one more question to you directly, if I may, and that is, there is a real feeling in this country that illegal drugs should just not be used, that it sets a bad precedent and sends out a message that is wrong for the community to have. How do you feel about that? I mean, do you think that an exception needs to be made and that there is not a double message that is sent out?
No, there's no double message at all. The message that we have compassion and can give sick people the drugs that they need is a message that we would be sending by allowing the seriously ill patients to have medical marijuana. Now, we're talking about AIDS, cancer, glaucoma, multiple sclerosis. These are seriously ill people, and for them to deny them this drug that they medically need is the outrage.
Let's go to Mr. Dogoloff and ask how he responds to that. Mr. Dogoloff, here we hear from someone who has used a drug for medicinal purposes. Aren't we sophisticated enough in this country to be able to separate out the abuse of a drug and the use of a drug that has shown therapeutic value?
Absolutely, and I want to differentiate very clearly between synthetic THC, which is the psychoactive ingredient in marijuana that has the action, which is found in the drug Marinol, and the crude drug marijuana from the plant. I am opposed, the American Council for Drug Education is opposed to the use of that crude drug because we don't believe that the science really suggests that that makes sense for the following reason. That, for example, in a California study of over 300 patients, what they found is that low-dose synthetic marijuana worked far better than higher dose, which one would get in the marijuana cigarette. In addition to which, the marijuana cigarette has effects that are potentially dangerous, including lung damage, including reduced immune deficiency, increasing your immune interrupting your immune response.
Let's hold it at that, if we may, for a moment, as I go to Mr. Randall. This is so interesting, Mr. Randall. We have Mr. Dogoloff on the one hand, who was talking about the fact that the alternate drug, the substitute THC, would be better. And then we have Ken Jenks, who says his wife has tried that and that it has not been as effective as marijuana. You use marijuana for glaucoma. Let's hear what you know of the studies and of clinical experiences, the first-person experiences, such as the one we just heard from Ken.
Well, in my own experience, I was tested on Marinol in 1975. It proved to be ineffective. If I had been forced to use Marinol, I'd now be blind. So there is a profound difference between the therapeutic effect of a synthetic substitute that the government and Mr. Dogoloff would like to promote and marijuana, which actually works. Kenny Jenks' experience is not unique. There are hundreds of AIDS patients in this country, if not thousands, who've already tried Marinol. If you give those patients a choice between marijuana and Marinol, they consistently choose marijuana. And that's not because they like smoking. It's because smoking is a more effective means of delivering the drug. For example, it takes 1 to 4 hours for Marinol to work. You have to know 4 hours ahead of time if you're an AIDS patient when you're going to be nauseated. Marijuana works in 10 minutes. That's a profound difference. that patients can sense. And I think the difference between Lee Dogeloff and Kenny Jenks is quite clear. Lee Dogeloff is a public policy expert who has, for his entire career, promoted the war on drugs. Kenny Jenks happens to be a patient who actually needs to take drugs. And there's a profound difference in the way these
Let's
two...
have Mr. Dogeloff respond to that.
Well, you know, back at the time when I was at the White House, I promoted the availability of synthetic THC for cancer patients when it was just at the beginning, because I felt it was very important to have that drug available.
And I wouldn't disagree with that.
And my concern is not to base this on anecdotal studies, but look at of what an individual says, but look at the studies and the research where you have double-blind studies and where you have people who, for example, are comparing, not knowing what they're getting, and comparing marijuana with the crude drug.
It's difficult.
And that's what I think makes a difference.
It's difficult to compare an oral medication with a smoked medication and pretend that that's double-blind. There have been studies done in 6 states involving more than 1,000 patients which consistently show that marijuana is far more effective, that it's safer, it does not cause the anxiety that Barbara Jenks experienced when she tried Marinol. And I think ultimately what we're saying is this decision should be made by patients and doctors within the privacy of the practice of medicine, not by bureaucrats.
Let's let Ken Jenks get in, if we may. Mr. Randall, I think he'd like to say something. Ken?
Yes, I would. I'd like to say something about Mr. Dogeloff's accusation that marijuana damages the immune system. My wife and I have been using marijuana for every day for 2 years, and having AIDS, I think we would have found by now that our immune system, if it was damaged. What marijuana does allows us not to throw up and to have an appetite. And that, in that respect, marijuana can help us to survive. Instead of damaging our immune system, we're putting...
Mr. Dogeloff, may I ask in response to what Ken has just said, does the government, does anyone really have a right to come in and to make a statement about how you should feel and what you should use when you, as a study of one, have not found it to be effective and not to do the job, but rather that a substitute continues the suffering and the authentic drug does not? I mean, can we really say to someone, it's all in your head and this really does work as effectively?
No, I think if we're talking about the anti-nauseating effects, there have been many, many studies which show that not only is Marinol equally effective to marijuana, but also that there are a wide variety of other drugs that are also available that are equally effective, if not more effective. So we're
Lee, you're not listening to what the patient is saying here. Kenny Jenks and Barbara Jenks tried at least half a dozen prescription anti-nausea medications, in addition to Marinol. They did not work. Marijuana did work. Now, what you're doing is denying human experience and suggesting that we should shut our eyes to these human needs and pretend, for symbolic reasons, that marijuana doesn't have medical value.
Bob Randall, I just want to ask you one thing before we go to our audience. You have suggested that there are also a number of studies that suggest that Marinol is not as effective as marijuana. As Mr. Dogeloff has indicated, that there are studies that suggest that Marinol is as effective.
Which is ultimately why the decision should be made by the doctor and patient, particularly by the patient who's going to use that drug.
Let's go to our audience now, gentlemen, and include them in on our discussion. Here is our number. It's 212-643-0077. Come and join us.
Since the war.
We're talking about smoking marijuana for therapeutic purposes. We're talking with Lee Dogeloff, who's Executive Director of the American Council for Drug Education, Robert Randall, who's President of the Alliance for Cannabis Therapeutics, and on the phone with us today is Ken Jenks, an AIDS patient who is being treated with marijuana. To our phones, and first to Helen in California. Hello, Helen.
Hello, Sonia. I happen to be a grandmother, and I've seen my children and my grandchildren get hit with the drug culture, besides being in the medical profession as well. And my question is, if our doctors can turn our people into drug-abused users through legal drugs, why can't they use the marijuana to help cure those who are ill?
Well, because marijuana is not curative of anything. The principal psychoactive ingredient in marijuana, which is the delta-9 THC, has been demonstrated to increase appetite and reduce nausea. So we're not talking about curing anything, and we are talking about making that compound available to people who need it. I understand the difference and how compelling it is to have an individual situation being portrayed. But what I'm looking at is data that involves hundreds and hundreds of people who have been studied, where it shows that, in fact, you get a better result for reducing nausea with low dose.
Are you suggesting that Mr. Randall is not telling us the truth when he says that there is data that demonstrates the opposite, Mr. Douglas?
Let's look at this. The DEA's own administrative law judge reviewed over 5,000 pages of evidence. He heard testimony from over 60 expert witnesses, and he concluded that marijuana clearly has medical value and should be made available to physicians for prescriptive use. What Lee is arguing here is that federal bureaucrats who do not practice medicine should make decisions which affect the welfare of desperately ill people.
Ken, I think Ken wants you to jump in for a moment.
And what I'm saying is that Marinol is not near as effective as marijuana. There are 300 to 400 chemicals in marijuana. How can they single out one element and say that's what helps you? Marijuana
Let's go on to our phones. Thank you, Ken. We'll go to Barry in Mississippi. Hi, Barry.
Hello. We are overregulated by the government anyway, and it seems to me that the natural state of a drug, as in marijuana, is much better, and Mr. Randall has the right idea in letting people choose for themselves whether they want to take some synthetic compound instead of just the natural given to us by nature.
The direction that medicine is taking and has taken is that we always prefer to use the synthetic and pure form of the drug that has the action than we do the crude drug.
Let me translate that.
The crude drug has many, many more things in it, and some of which have negative effects. And what we want to do is separate out those parts of the crude drug which have the negative effects and just give to people those parts of the compound which has the curative effects.
Robert, you had a comment about that.
Well, it seems to me that federal regulators, people like Mr. Dogoloff, are much more interested in synthesizing and making expensive products than they are making that product more effective. If marijuana were less effective than Marinol, patients would not be asking for legal access to marijuana. Marinol is already legal. The reason that patients are requesting legal access to marijuana is because it works. It also happens to cost about a penny per dose. So I think what we're confronting here is an imperative among certain regulatory agencies to make sure that pharmaceutical companies make a profit rather than people get care that they need.
We're going to go to California and William now. Hello, William.
Hi, Sonia. So nice to visit with you.
Thank you.
I have glaucoma, and it's prevalent in my family along with RP. And what we've noticed is every single person in the family has gone blind except the two of us who use marijuana.
Interesting point. Mr. Dogoloff, let me ask you something. When a patient is terminally ill with cancer, very often the physician will make a decision about the use of a narcotic that would never be given to this patient under any other situation, morphine, for example, and we'll have a morphine drip over a fairly long period of time. Why not allow the physician to make the decision about Marinol or marijuana, since if the physician feels as you do, he or she would be able to use a clinical trial on each patient to find out what works?
Well, I think we're talking about issues of safety and efficacy, and that is within the purview of FDA, and that is what is being examined in terms of what the scientific evidence is, not in terms of what the emotion is. There is no one who's
Are you suggesting that the physician would be emotional and not scientific?
No. What I'm saying is that the purview of the FDA is, and the role of the government is to approve drugs for certain certain uses based on their safety and their efficacy. And in this country, we have to prove safety and efficacy before drugs are approved. I think that's a good practice. I think that protects people, not hurts people. And that's what
I'm going to let
do.
Ken Jenks have the last word, gentlemen, if I may, since he is the one who is fighting for himself, and allow him this opportunity. Ken?
Yes, I'd just like to say that marijuana should be available by a prescription. The decision should be between the doctor and the patient as to whether marijuana can be a benefit. My wife tried Marinol. It didn't work. Marijuana did.
Well, gentlemen, I want to thank you very much for bringing up a fascinating issue, one that I'm sure that we will hear more about, and I appreciate your varied points of view.
Thank you.
What you are watching is quite rare. This man and his wife are smoking marijuana, but legal marijuana. They're among only 14 people in the United States who've had it prescribed by their doctors. Applications have to go through the DEA, the FDA, and the National Institute of Drug Abuse. And if all approved, the legal marijuana grown on a government farm in Mississippi is sent to the patient's pharmacist, a month's supply of cigarettes at a time.
I'm Morley Safer.
I'm Ed Bradley.
I'm Steve Croft.
I'm Leslie Stahl. Those stories and Andy Rooney tonight on 60 Minutes.
Marijuana is not good for you. It's an axiom. But for some people, marijuana could be the difference between life and death. That's what they and their doctors say. The doctors prescribe it, and the patients smoke it to live.
What you are watching is quite rare. This man and his wife are smoking marijuana, but legal marijuana. They're among only 14 people in the United States who've had it prescribed by their doctors. For Ken and Barbra Jenks, marijuana is but one more of the myriad of prescription drugs they must take every day.
How often do you smoke these?
We usually smoke, well, I usually smoke at least 3 to 4 a day.
What would happen to you physically, both of you, if you went for a couple of days without these?
You throw up all the time.
I would get sick to my stomach.
I mean, you couldn't. You get sick.
I wouldn't be able to eat.
Your medicine. So, and then you can't eat. So, I mean, the weight, and then you start losing weight. So, I mean,
having AIDS is like a wasting syndrome. With the virus and everything. The smell of food, just even thinking about food just makes you nauseated.
Ken and Barbra Jenks are dying. He is a hemophiliac. 11 years ago, he was given blood contaminated by the AIDS virus. He unknowingly infected his wife. They are both too sick to work. They live on disability, barely able to cope. Without the marijuana, they would probably be dead. Would have wasted away because of the nausea brought on by their chemotherapy. Before they got marijuana legally, they bought it on the street or grew it. Until last year, when police burst into their trailer in Panama City, Florida, and got the goods on them. 2 marijuana plants.
and then they started, going through my house. I mean, just dumping drawers and tearing the cabinets up.
The police thought they were onto something big when they found a suitcase filled with syringes and other drug paraphernalia.
And they were going berserk.
Ken tried to convince them that the syringes and the pills were prescribed by doctors. He did not tell them that marijuana was the only medicine that enabled them to take the chemotherapy without being violently ill.
You're talking to somebody that never wanted to take an aspirin for a headache. It's a relief to know that there's something that you can smoke to relieve the nausea from taking all the medications that you're on.
The Jenks were charged with growing marijuana and possession of drug paraphernalia. In court, their lawyer, John Daniel, tried to prove that for the Jenks, marijuana was a medical necessity. Did the prosecution present any counter evidence?
None whatsoever, sir. In fact, they even stipulated in Kenny and Barbra's case that it was beneficial for them and that they would die without it.
The prosecution conceded that?
Yes, sir.
But you lost the case because you couldn't prove medical necessity, so that doesn't jive somehow.
Judge Foster said there is no such doctrine as medical necessity in Florida, that it's a matter for the legislature to promulgate a statute that says that it is or is not.
But the judge was not an unsympathetic judge.
Super judge. The sweetest sentence I've had in 20 years of criminal defense work.
The judge found them guilty, but sentenced them to 500 hours of community service. Their only task, to look after each other. As decent as the sentence was, the Jenks were outraged that they were still considered criminals. They decided to appeal.
Kenny and Barbra said, go for it. We're going to be gone soon. There's going to be people following in our footprints and in our pain and suffering, and there needs to be some law made one way or the other on it. That's why they took it up on appeal, and I'm glad to do it for them.
Why? They're not exactly the wealthiest clients in the world.
I'm not exactly charging them, sir.
The DEA classifies marijuana as a highly dangerous drug in the same class as heroin and LSD. And the only way to get it legally is to face a bureaucratic jungle, 3 of them. Applications have to go through the DEA, the FDA, and the National Institute of Drug Abuse. And if all approved, the legal marijuana grown on a government farm in Mississippi is sent to the patient's pharmacist, a month's supply of cigarettes at a time.
So therefore she wasn't going to...
Robert Randall was the first American to gain legal access to marijuana for medical use. He was diagnosed with glaucoma in 1972. Doctors told him he had 3 to 5 years before he would go blind. One evening, he tried a marijuana cigarette.
It was a bit like a eureka experience. I mean, I had known in college that if I smoked marijuana, what the doctors then called eye strain seemed to diminish. But I had never put all the pieces together, and suddenly they came together. The next morning, I woke up and thought that I was crazy. It's crazy to believe that an illegal drug is going to prolong your sight when all the modern pharmaceuticals have failed to do so.
Randall is still on prescription drugs, but his doctors found that the essential drug in relieving the intense eye pressure of glaucoma was marijuana, which he's been smoking for 15 years. But getting it legally was not easy.
It took 14 months from the time of my arrest. I had to go through...
You were arrested for possession?
I was arrested for growing 4 marijuana plants. I had to go through 2 controlled medical studies that were really unnecessary. They simply demonstrated to others what I already knew to be the case. And then I had to wait around for many months while a bunch of bureaucrats who were really not very excited about this idea decided whether or not I would go blind. It's a very uncomfortable, frightening situation to be in.
Only 14 people are now able to get marijuana legally from the government. It took the Jenks almost 9 months to get their first prescription. Many doctors are reluctant to make the effort, fearing that the ramifications of even applying for marijuana will affect their reputations. The Jenks' own doctor, who prescribes marijuana for them, won't come on and talk about it.
A junkie doctor. He doesn't want to be called that. I understand that. It could also be, I'm afraid I'll have all of these people coming out of the woodwork saying, oh, I got a back pain. Doctor, how about giving me 400 joints? I can understand that.
But many doctors say their reluctance to apply for a prescription has nothing to do with bureaucracy. Dr. Richard Gralla, who heads the Department of Oncology at the Ochsner Clinic in New Orleans, told us that the scientific studies do not show marijuana as effective as other drugs, despite the claims of Randall and other patients.
There are testimonials for almost any medicine. And in fact, sometimes testimonials are the germ of a good idea, the beginning of a good idea. Unfortunately, more often than not, they're just that. They're just testimonials.
But Dr. Lester Grinspoon, who practices psychiatry at Harvard University, disagrees. He's one of the first physicians to take a stand on using marijuana as medical treatment.
It is very useful for the treatment of the nausea and vomiting, which accompanies the use of some chemotherapeutic substances for the treatment of some cancers.
Dr. Grinspoon knows it from the most personal kind of experience. His son had leukemia and died, but during the chemotherapy, Grinspoon feels it was the marijuana that was keeping young Danny alive.
He would be so tense before he took the medicine because he knew what was going to follow. And what followed was 8 hours of first vomiting and then retching. It's very, very difficult. He got to the point where he said, I'm not going to take the medicine anymore.
How old was he?
He was 15.
His wife bought some marijuana near a local high school. At Danny's next treatment, Grinspoon was amazed.
It was absolutely stunning, the difference that this made. He was relaxed. He had the treatment. He not only did not have nausea and vomiting, but he asked if he could get a submarine sandwich on the way home. I was really dumbfounded. I then called the doctor, Dr. Jaffe, who was taking care of him, and told him what had happened. And so the next time, he smoked cannabis right in the treatment room at the Children's Hospital. Same thing, not a bit of discomfort, ate afterwards. And it was then that Dr. Jaffe and I went to the head of the Children's Hospital, Dr. Fry, and suggested that maybe this bore some kind of systematic looking into. And that, in fact, led to the Salin study, which first established that this is that useful in the treatment of the nausea and vomiting of cancer chemotherapy.
But the DEA has maintained for years that marijuana has no therapeutic value, that it's a dangerous drug that must remain illegal. However, no one from the DEA would come on this broadcast and respond to the scientific evidence of those who say otherwise. 3 years ago, the DEA's administrative law judge, Francis Young, wrote of marijuana, in light of the evidence, it would be unreasonable, arbitrary, and capricious for the DEA to stand between those sufferers and the benefits of this substance. But the DEA rejected its own judge's opinion and stands firm that doctors shall not prescribe marijuana. Except, of course, for those few who are willing to go through the agonizingly long process of applying. Desperate patients say they would rather live by buying marijuana illegally than die by playing by the rules. Dr. Ivan Silverberg hears that all the time from his cancer patients in San Francisco.
I have yet to hear of a patient who can't find it. I have heard loud and clear from patients who resent having to go on the street when they're feeling sick, when they're nauseated, when they've lost 40 and 50, 60 pounds, to try and buy a drug from somebody without knowing whether that drug is adulterated because it comes off the street, of having to face the possibility the person they're buying from it is an undercover policeman. I think all of these things are wrong.
But Silverberg says if he had to fill out that mountain of paperwork every time a patient needed marijuana, he wouldn't have time to treat his patients.
Why has the DEA dug its heels in on this and will not allow the general prescribing of marijuana by physicians when you can prescribe much more dangerous, much more habit-forming drugs?
You're absolutely correct. I think morphine, for example, Demerol are far more hazardous drugs, in my opinion, than marijuana. I think part of it is an entrenched bureaucracy that doesn't want to admit it's wrong.
Even if it were available in 10 minutes down in the pharmacy, I'd be reluctant to write it. Has nothing to do with the political issues that we have in drugs and the drug problem in the United States. It's the fact that in my own experience in using cannabinoids, in my patients' experience who have smoked marijuana, neither marijuana nor the cannabinoids measure up to those drugs that I have.
Among those drugs is Zofran, which has been on the market only for the past few months. By all accounts, it works wonderfully.
Zofran is the most effective drug, which is said to have an 80% response rate. By their definition, costs $600 a day.
And the patient has to have it administered in the hospital?
Or in an ambulatory care center where he's there essentially the whole day.
If marijuana is as effective as Drs. Silverberg and Grinspoon say it is, why haven't the drug companies tried to get government approval for it?
Can't patent marijuana, it's a plant. They can't make any money, no way. You see, in our country, the way drugs come into being, a drug company gets hold of a chemical. Somebody discovered it has some sort of effect. They review it, they decide, is it worth trying to do it? They have to invest between $80 and $100 million to get it from chemical to drug on the shelf. But then they get an exclusive patent for 17 years, and they can earn a lot of money. How could they possibly do this with cannabis?
For the Jenks, marijuana has made their troubled lives tolerable. And to the doubters, they say,
do I look like a junkie?
Do I? I mean,
I wish I didn't have to take the medication that I wish I didn't even have to smoke marijuana.
It'd be nice to be free of drugs and disease, but we're not. I mean, we need drugs. I can't help that. I mean, I've been taking drugs my whole life, and it hasn't made a junkie out of me.
Do you ever agonize over why me, why us?
At first.
At first we did.
But then, I mean, for me, it was easier. I mean, I've been dealing with disease since I was 6 months old, so it was just like fuel to the fire. I mean, you know, it was just one more thing.
He blamed himself because I had gotten it. And I don't blame him because he, you know, I love him. He's my husband.
You know, these are the cards you got dealt. You just got to play them or fold, kind of.
The Jenks eventually won their appeal, and their criminal convictions were overturned. The Public Health Service is not accepting any new applications into the program for marijuana prescriptions and is considering closing it down entirely, regardless of what patients say.